and how to coach your patient. So we teach that program. Then we teach other programs so they can get into diabetes, health coaching, wellness coaching, but not following the federal program that she has, because that's very focused with A1C. So then we have other ways of teaching in there where they have a little more variety and they can get into nutrition and all kinds of other little goodies. So that is for RNs, LPNs, and also if someone is a health coach, they can take that course, or a non-nurse. We have two different diplomas. If they're a non-nurse, they don't get one that says nurse, certificate of completion. And then the nurses have a different certificate. So it's a great program for nurses. We've geared it to nurses, but every once in a while we change up some of the, when I talk, to say, okay, I know you're not a nurse, so you're not going to really understand this and medicines and this and that, but you should be aware of what your patients are on and have some general idea, especially because if you're a health coach, you're usually working with the doctor too at some point. All my programs are work at your own pace, but we all have every course has a special group, a Facebook private group that we expect you to come into and visit quite often, once a week, once a day.
Community building is so important for nurses. I especially think that for nurses that are leaving the bedside, because the bedside is such a community. If you are arguing with your coworkers at the bedside or supporting your coworkers at the bedside,
right, you still got some
definitely a niche community.
Right.
So it's awesome to hear.
A lot of nurses will say, am I going to be lonely working from home? Well, no, because you have a team. They're on video for you, or they're by the phone or whatever. Now, if you do HEDIS, where you're not talking to the patients, you're just working behind the scenes, tallying up the numbers, or you do utilization review where you never really talk to the patients or the doctor's office, you're tallying numbers, you're behind the scenes. Some of those nurses, usually when they take those jobs, they're thrilled because they don't want to talk to anybody anymore. They're burnt out. Or they'd be like, I love people, but I'm sick of it. But sometimes some people take those jobs because they see, oh, the pay was good. And oh, Marie, see, I show them all these different jobs that they can get. Like right now, I have a contact with CBS and she's pushing all my nurses through to, get them past the scanning system and into the hands of a manager or recruiter. So we have all these jobs, and I have many connections, and I don't always have, connections all the time, but when I do, I have all these connections, and they're like, oh, I think I'm going to take that. Marie says, great company, this and that. Then they get into it and they're like, oh, so I'm not interacting with patients at all. I'm making this great money, but I'm lonely because I want to talk to my patients again. So sometimes a nurse might take a job where they're totally away from the interaction with the patient's family, the doctors, and they miss that. So sometimes, if you hear somebody is really unhappy, sometimes it's just they took a job that maybe wasn't right for them. And, then they go into maybe something else. I have some, they go into maybe case management or care coordinator. I do want to say, LPNs that are listening, I would say 30% of remote work jobs will go to you. That's it, 30%. The rest are going to go to RNs. So I always tell my LPNs, sometimes we'll have a lot of opportunities for you all at once. Other times it'll be a little quiet here and there because, yes, 70% of the jobs are going to go to RNs. They want RNs, various reasons. So it's not the LPNs can't get a job. They do. But sometimes they have to work a little harder to get those applications in. And like with Humana, I had like 500 or 600 nurses that got in, LPNs that got in with Humana almost 2 years ago. Well, that's the last time LPNs were hired much with Humana. And they all got in as like case managers, but they're under an RN. They're not associate case managers, but they're in like a pod. They'll have a couple RNs and then they'll have a bunch of LPNs as case managers with Humana. Well, Humana hasn't hired LPNs much here and there, but in the past 2 years. Why? Because those LPNs that got in are not moving. Can I say one more thing about the RNs? This is a big one that comes up. you don't have to be a BSN to work from home. So I'd say 80% of the jobs will take an ASN, associate's degree nurse, or even a diploma RN. So BSNs, sure, there are some jobs here and there. Like out of 10 jobs, there might be 2 that will say you must be a BSN. 2. The others might say we prefer a BSN. Preferred means nothing. I tell my nurses not to even look at the preferred section of the job. When the job says, what do you need, for this job? What's the required? Preferred, ignore it. So many times the ASNs will be like, oh, but it says BSN. I said, no. Lots of times it just says preferred.
Yeah, that's huge. I actually started with my ASN. And it was my hardest degree to get from my bachelor's or my master's was my associates. They jam-packed that degree.
Yeah,
So,
yeah.
yeah, I'm a huge proponent for associate's degrees, especially if it helps you get your foot through the door as a nurse and you can climb up or just stay where you are. So if there's not a like degree requirement, is there a certain amount of time that you need to work at the bedside for?
That was perfect. Thank you. Yes. Well, we tell the nurses that they have to have been a nurse at least 1 year, and they need patient-facing or bedside experience. So what patient-facing is, maybe they worked in a doctor's office, bedside just means bedside. The word bedside means, did you touch your patient? That's what it really means. When we say bedside experience, it doesn't mean you had to be in the hospital at the bedside. But I mean, if you were in the hospital at the bedside, that's great. We say 1 year bedside or patient-facing experience. Now, sure, if you have 2 or more years, it's better before, to get into these remote jobs. I don't usually let anyone take my course unless they've had 1 year of bedside and patient-facing experience in the USA. And so, yeah, many of the nurses will say, well, why does it say, oh, you need 3 or more years? And I said, well, some companies will say they want 3 or more years. Some will say 2. And once in a while, they'll say 1, or they don't say anything. They just, leave it open.
Yeah, thank you for clarifying. So, Marie, we unfortunately have to wrap this up, which is a bummer because I feel like I could go on for so long. So, thank you so much for taking the time out of your day and really breaking things down on such a basic understanding level. Thank you.
Can I say one more thing about the years of experience? Many people will say, well, why do I have to have, 1 year or more, or 2 years or more, whatever? It's because of malpractice. When you are a nurse and you are remote from home, even though you have a team you can call and they're on video or whatever, and you're not really alone, but you are alone. It's a matter of the hospitals, the facilities, they have to pay malpractice insurance on everyone. And the companies, these insurance companies, are not going to let them hire you if you haven't had any bedside experience. Because, I mean, really, you need more than a year to have decent theory and really do the 360 degree, hands-on. And you learn from other nurses as you work with them. But yeah, it's malpractice reasons. They say, no, that person, I don't care, if they were a nurse's aide for 1 million years, they have not worked 1 year at the bedside.
Yeah, so they don't know the role. Yeah. Thank you. I had no idea on that either. Great inside tip to leave us with.
Well, thank you for having me. I appreciate it.